A cardiology specialist working in the university hospital center noticed that a large number of his patients who had MI also had some sort of malignancy in their medical history. In order to determine whether a relationship existed between MI and malignant processes, he decided to pursue a case control study. His selected cases consisted of a sample of patients hospitalized in an internal ward with a history of MI, while control cases were patients in the same ward without a history of MI. Their charts and medical documentation were then revised for a history of any type of malignancy. The results of the study led the cardiologist to conclude that for the patient with malignancy, the odds of having a MI were 3.2 times higher when compared to patients without malignancy. If the cardiologist was aware of Bergsonian bias, also known as the bedside or the admission rate bias, how he could have minimized it by which of the following means. Now here there is this thing that whether a relationship exists between MI and malignant process, he decided to pursue a case control study. So how can we minimize the bias? So Bergsonian bias, a special type of selection bias that arises when cases and controls are recreated from in-hospital patients if the combination of two distinct conditions increases the overall risk of hospitalization, then the prevalence of malignant processes will inevitably be higher in MI sufferers than those without it. In other words, it causes overrepresentation of exposed case hospital patient than exposed in other disease. Okay. So the education by learning objective is Bergsonian bias as a type of selection bias that arises due to the fact that the identification of multiple diseases and condition in patients involved in studies statistically more likely in hospital clinical settings. Therefore, a careful selection of control groups is always warranted, especially when designing a case control study. So I hope everything is clear to you.
Thanks for watching. Please give a thumbs up and subscribe for more.